Emily is a woman in long-term recovery. She has been in recovery since March 5th, 2015. She's been a CPAD since 2017, and she got her MBA in 2019. Her role with Georgia Council for Recovery is Director of Education and Curriculum Development. She manages contracts, supervises a team of employees, and writes grant proposals to help diversify funding streams that support our organization. Okay, so I'm going to do a poll now of who's here. Recording. Okay, give me just a second here. Okay. Al, can you put the poll questions up?
Let me check. Hang on just a second.
Okay.
Can y'all see that?
I can, yeah.
Yeah, I see some of the answers are coming in.
Okay, thank y'all.
I'm gonna leave it up a little bit, and someone is unmuted. If you want to check and see, I think it's, and I'll go ahead and mute people. Okay. There we go. Anybody else want to answer? We are only at about 80% participation right now.
Okay.
I will go ahead and end the poll in just a second. Here we go. And there I am sharing the results. Can y'all see that? All right, I'm going to take a picture of that, so we'll have that for our records. And we are ready to go. Tara, you ready for Emily to go?
Yes, I'm ready for Emily to start.
All right, can we clear the poll from the screen, y'all? Because I see the poll up there.
Yeah, I can't see it, so Al, can you take it down? Thank you. Thank y'all for y'all participation.
Al? I'm so
Did that
sorry.
do it?
No,
that
I
do
still see it. Does everybody else still see it? I still see who is here. Do I need, maybe I need to do something or?
It says that it's ended. I am sorry about that.
That's okay. That's okay. Whoops. Oh, goodness gracious. I gotta go back to the. Yeah.
Is it still up there?
Mm-hmm. It is on my screen.
I can't see it on my screen at all.
No. Yeah. Yeah. I don't know. It's still.
Emily, do you have a close button
I don't, hold on.
on the poll itself?
Hold on. Let me move some stuff out of the way.
Did that do it?
There we go. Thank you, George.
Okay.
All right,
My
great.
apologies.
No, I think that was on me, but my stuff, my ribbon across was covering the close button. So thank you, George. I didn't know to look for it. So thank you. Appreciate that. Good afternoon, everyone. Good evening. I know everybody's super tired after a long ARAD. What a great experience. What a wonderful day. It was great to see some of you. I never take enough pictures, and it's just really, really wonderful to be here on this great day. What a great way to end the day, right? And so most of you who are on this call know who I am already. Tara, you did a wonderful job introducing me. Thank you so much. The only thing I would add to that is that I'm also CPS mental health, and that's about it. So that's who I am. And we're just going to cover some grant writing basics. Now, I want to say that the more I dig into this information, there's just so much to share. So I'm certain that there's going to be information that I am not able to cover today that you want to know more information about, and I apologize for that. I will be happy to look into things for you, specific or broad. I wish I could cover every single thing, but we just cannot do that in an hour and 15 minutes. But I want to do the best that I can with the time that we do have. So hopefully you'll get something out of this. And basically, what I did with this presentation is it's lessons that I've learned, because that's what I said to Jean the other day. And George certainly knows this because I've been working with George since day one, since I started at the council. I did not learn how to write grants overnight. This is not something that I just woke up one day and said, oh, I'm just going to learn how to write, I'm just going to write a grant today. It took a lot of practice, and a lot of lessons learned and a lot of bumps along the way. And that's okay. But that's why we're here today, to talk about some of these things. So thank you all, and we'll go ahead and get started. So the learning objectives for today. And I think what I'd like to do here is, if I can, just eliminate, I'm just going to spotlight. Well, how can I do that? No, I don't want to do that either. I'm trying to just hide self-view or something like that. I'm trying to be able to see you. There we go. Gotcha. All right. So the learning objectives for today's session are, why is this so important? What are some things that you want to look for in terms of what to apply for? And how you will know what to apply for. The process is really filling out the grant application, what that looks like, what are some things to really look for and think about and plan for. And then, of course, the payoff is, what's the reward for all of your hard work in this? So that's what we're going to cover. And we want to start with the purpose, right? And so, and I know we talk a lot about this. We talked about this at the CARES Connect back last year. Kathy Cave covered some of this, and some other folks cover this. We talk about our why. What is my why, right? I can talk about what my personal why is, certainly, about my recovery journey and why I do the things I do and why I work for the Georgia Council. And then I can also take that and make that a broader picture and talk about the organization why. And so basically what we really want to touch on here is, what is your organization's, what are your core values at your organization? What is your organization's mission? And what is your organization's vision? Now, so your mission is who we are and what we value, right? That's our mission. The Georgia Council's mission is to increase the impact of recovery in communities through advocacy, education, training, and providing peer recovery support services. That's our mission statement. We do this is what Neil used to always say. We do 4 things. We advocate, we educate, we have training, and we provide peer recovery support services. Okay, so the idea here is you want to stay true to that mission. And the reason why I bring this up and why this is so important is there's this term called mission creep, and you can Google it. What happens is, if you see an opportunity for funding and you say, well, it's not really what we do, but we can make it work because we need the money, right? Be careful with that. Be careful with that, because if you move too far away from your mission, we get away from doing what it is that we're really good at. And then you'll find that, you're not doing what it is that you love to do in the first place. So just beware for that. Just really stay true to your mission, okay? And that's just something to keep in mind, because it's easy to do. If you see something, that's like you're feeling a little desperate, need a little bit of funds, and so just keep that in mind. And then your vision, the organization's vision is, where do you want to go? Where do we want to see ourselves? Where do we want to see ourselves a year from now? Where do we want to see ourselves 3 years from now? Where do we want to see ourselves in the future, right? That's your vision statement, where it is you want to go, okay? And then the strategy is, how are we going to get there? What are we going to do? What steps can we take? What are we really good at that will help us get to that, wherever it is that we want to go, okay? So those are some things you want to think about. And then the key points to a grant proposal are very clear and concise goals and objectives. And we're going to get into that. All right. Now, when you're thinking about a grant proposal, you want to consider some things and be straight up honest with yourself. Okay. Do we have the capacity to do this? Do we have the time? Do we have the staff? Do we have the resources? Do we have the partnerships? Do we have what it takes to make this happen? You know, and some projects are just so big, and other projects are completely doable. And this is where I want you to really consider the fact that sometimes it's better to work in partnerships, right? So I don't have to, just like recovery, I don't have to take it on all by myself. I got partners I can lean on. I've got an RCO, you know, that's 30 miles away that I can lean on. Maybe we could do this together. Maybe we could cover the region as opposed to just trying to do it all by ourselves locally, right? So just some things to consider. Can we meet the deliverables? Think about that. Deliverables are very specific. They want very specific. This is what we say we're going to do. This is how we're going to do it. This is when we're going to do it. And this is the outcome that you're going to see as a result of the work we do. Very specific. Think about that. Can we do it? Okay, so that's something to consider. Financial stability. So, and those of you who know DBHDD, right, so you might be familiar with this. Sometimes it takes a while, and sometimes costs are reimbursed. So you got to do the work and then get paid. And I know, you know, you guys have seen that with Georgia Council. We have to wait till we get paid so we can pay you. I mean, it's really a challenge. It's a real reality in the work that we do. It might not be for other organizations, but for the work I do, I've seen it. And so you want to think about the fact that financial stability is very important. Do we need a fiscal agent to help us? Do we need somebody in it that can help us maintain the finances of this project so that we can do the work and then and not have to worry so much about, you know, can we pay our bills every month? So just really kind of think about that and be honest with yourself. Do you have the financial stability at this point to do this work? And hopefully you do. So having said all that, we want you to dream big, right? We want to dream big. I want our organization to dream big. There's sometimes I get stuck in what I do every day and I forget to see the bigger picture. And so Neil, if one of the many things that I've learned from Neil Campbell is to have a proposal on a shelf. Think about something, and I'll give you an example. Sierra's a prime example for the amazing work. Give it up for Sierra today for the amazing work she did on ARAD. Sierra had a vision and she worked with Larissa to come up with this idea. And so Larissa tasked her with creating the proposal. Do we have the money for it right now? No, we do not have the money for this proposal. But what she did was she sat down, she wrote down exactly what it would take for this certain project, how, you know, who the partners would be involved, how much it would cost to make it happen, how long it would take, who would be affected by it, all the key elements, so that when we get an opportunity for funding for this, we're off and running. And you watch, if you have something like that ready to go, you have the pieces of it ready to go, put it down on paper, you know, put it down in a file somewhere, share it, talk about it, work on it, get it ready to go, so that when the funding opportunity comes along, you're halfway there. You've already got something ready to go that you can fine tune and get together and send in. That way you're not starting from scratch. I highly recommend that. That's really key. So you want to think about just some ideas. Do you have potential for organizational growth, capacity, and sustainability? Do you have an opportunity for deeper relationships and partners in the community? Or do you have something that you want to expand in terms of programmatic ideas? So something that, you know, you love this program, it's going really well, you have a little pilot happening, or you want to even start a pilot program because you know that it's going to take off in your heart, then get a proposal ready for that program, whatever that might be, and have it ready to go. I really strongly suggest, I know we're all busy and I understand that, but when you start to think about some of this stuff and you're ready to go, it's amazing what'll happen when all the things line up. You know, the stars align and it'll take hold. So what do we want to do? We want to plan. We want to have an action plan, right, out of all of this. And so some sources of grant funds, and again, if you have any questions, hold them until the end. I would love to hear from you all about questions you have about sources of grant funds. But some thoughts are Congressional District Representative Office. They have what's called discretionary funding. And it happens a lot at the end of the year even, where they'll have some extra money and they need to put it out into the county or the local area. And if you reach out to their office, they will instruct you on how to submit for this type of a grant. Now, interestingly, I have learned that you don't have to lowball yourself because they'll take the lowest proposal. We submitted 3 proposals one year to Lucy McBath's office. We submitted one for like $2 million. We submitted one for $200,000. And then we submitted one for like $27,000. And so they gave us the $27,000 one, which was wonderful. They did give us $30,000, but it helped us keep a part-time employee in a job for a year, and she did a great job, and it was wonderful. So that's a really great source of funding just to think about. Local utility companies and software manufacturers, there are organizations out there that are trying to promote their own products, right? And they're trying to find a way to promote their own products, or they want to help the community. And you know, corporations, this is basically corporations need to give. It's really about them wanting to give back to the community, and they get tax write-offs for it, right? So consider that. If you know of a large corporation that is like, for instance, Home Depot, you know, they're a very big giver. That's a definite source of funding to look into, because they're good about giving, they support recovery, and so that's definitely a thought. And you want to go out and look on their giving pages. Walmart has a giving page, Home Depot has a giving page. There are many sources for that. Now, a lot of people may have heard of this Appalachian Regional Commission Inspire grant. And I hope that you've heard of it. Shatterproof put out a big blast about it. It is available right now. So you do need to be in that Appalachian region. Okay, so you can go out and literally there's a Wikipedia page about the Appalachian Region Commission. Just Google it. You can see where the area is, what areas it services. Take a look on their website. I have it in here. I'll share that with you. But that's a grant that it works on peer workforce readiness programs, which is, who doesn't want that, right? Peer workforce readiness programs. So programs that are recovery friendly, right? Then employers that are recovery friendly, which is what a great thing. So that's an option. And then also take a look into your community foundations. That's another resource for grant funds. Every county has a community foundation. So take a look into that. And there are others. Those are just examples. Those are just examples. So registering with SAM, there's a reason why I started with this. This is really important because even if you get a local grant or a state grant, they may ask you, do you have, are you registered with SAM? Because if it's state money, generally it comes from the federal government. Most money is coming from somewhere, and a lot of it comes from the federal government. So do yourself a favor and get registered with SAM. It's free. Don't ever let anyone try to charge you to sign up for sam.gov. It is free. Yes, it's a process, but they have a wonderful help desk. They will help you. What you do is, it says here, the instructions are very clear, how to get started, what you'll need. All of the information is there for you, but I would strongly recommend that you look into registering your organization with sam.gov if you haven't done so yet. That's called Systems Award Management. Okay. Next thing to look for is where to look for grants. So this is just a couple of examples of places you can sign into that will help you look up grant opportunities. Grant Watch is a great opportunity to sign up to look up different opportunities. And then Georgia Center for Nonprofits is another opportunity. Now, Georgia Center for Nonprofits, to become a member, there is a fee. There's an annual fee. But if you need to know what grant opportunities are out there, you are welcome to email me. And when that comes out, I will send it to you. You just got to remind me, but I will do it. I'm happy to do it. But again, if you see here on their website, funding and resource opportunities, now this list goes down. It'll tell you all the grant opportunities for that month. This comes out once a month. But they are a wonderful resource. Georgia Center for you can also take a grant writing course with Georgia Center for Nonprofits if you're interested. But again, it's not free, but they're not very expensive either. So those are just some places to look. And then grants.gov. So this goes along with that sam.gov. This is another place to get yourself registered, get the organization set up so that you have everything kind of in place for when you're ready to write a grant proposal and you're ready to do some work with the federal government, or, you know, there's a lot of information on grants.gov. These systems are all kind of tied to one another. So you need to set up your authorized official representative, or AOR. And we're going to get into acronyms. Actually, I sent out a list of acronyms. So AOR stands for, what did I just say? Authorized official representative, authorized official representative. So in our case, if, for example, that person would be Larissa, right? She's our ultimate authority to be able to sign checks, to be able to review financial documents, etc. So you want to kind of set up who does what at the organization. If you have someone who handles all the invoices, you can put them on here. You'll see, I know I don't want to get too down in the weeds on this stuff. We could do a whole nother session on just grants.gov, but you'll see where you can kind of set up roles within grants.gov of who can do what at the organization, who's just like your admin point of contact, who's your signing official, etc. So there's just some really important things to look into on grants.gov as well as sam.gov. So SAMHSA, I know you've probably all heard of SAMHSA. SAMHSA stands for the Substance Abuse Mental Health Services Administration. That's the federal government's agency that handles everything recovery related. We know that SAMHSA is the one who put out for Recovery Month. They are the ones who are really go-to source for a lot of really wonderful information, credible information about recovery. They believe in what we do. There are grants officers that work for SAMHSA that are actually in recovery. Tom Coder works for SAMHSA, and he identifies as both a person in long-term recovery and a gay man. He's a wonderful advocate for us. And it's great to have individuals like, you know, nothing about us without us, right, at this type of an organization, because SAMHSA puts out wonderful grant opportunities that are at the federal level. And if we can apply for these grants, they are just a wonderful opportunity for us to get our names out there, get the work that we're doing out there on a national level, right? So I encourage you to check out SAMHSA, look at what's going on, review some of the information that's on this website, and look into some grants that are available. Building Communities of Recovery is one that comes from SAMHSA. And there's a lot of other opportunities as well. So take a look into what they have to offer.
Emily, do you
I
want to
gotta
go
go back.
back? Is this,
Yep.
is this poll time?
Yes, thank you, Al. Go ahead.
Let me go back. I'm thinking it's poll question number 1 from the
It's actually-
ones that you gave
Yes.
us.
Yes, it is. Thank you.
What does NOFO stand for? Can y'all see it? There we go. I see somebody's answered it. I see them coming in. That's good.
I don't see it.
Emily, can you see it?
I can. You guys are nailing it. I made these questions too easy. No, I'm doing a
All right,
great
we'll wait a minute. We've got 72% participation. In just a second, someone. All right, I will end the poll and share the results.
I wish this was
Emily?
more interactive too. I apologize. I know I'm just blah, blah, blah. I hate that, but
So 35 out of 42 people have said that NOFO means notice of funding opportunity. 7% said notice of future opportunity.
good guess. But yes, it is. It's notice of funding opportunity. And thank you guys. That was wonderful. Well done. Well done.
As the poll go away, can you
Yes.
still see the poll?
Yep. Nope. I got rid of it. Thank
All
you.
righty, thank you.
All right. So yes. So notice of funding opportunity is an acronym that I would like for you to get to know. So I'm going to blast through that one. And then I'm going to come back to the next slide. Could you drop the next poll question, please, Al? 'Cause they
All
got flipped
right.
around, but that's all right. They got flipped.
Go up here to poll number 2. What does HRSA stand for? Can y'all see that one? There, I see somebody answering it, so somebody can see it. Yay! It's all coming through. We've got about 24 people who have answered. There we go. We're up to 30. That's good. Thank you all. Having really safe attitudes, says George Broad.
I love it. That's beautiful. It's so
That's a good one. I like that. All right, we're up to 41. So let me share the results. There we go. 28 out of 41 people, 68% say Health Resource Services Administration.
Correct. That's right. That's
That's correct. Excellent. Let me get a picture of this. There we go. I will
Okay.
stop sharing.
And for some reason, it looks like my slide, somebody was, I don't know if I did that, but it looks like it was annotated. Somebody wrote on the slide, but that's fine. Doesn't matter. I don't know how to get rid of that. There's the writing on the screen. So I apologize. I really don't know where that came from, but yes. So Health Resource Services Administration, well done group. You guys are amazing. Is a place that offers funding opportunities, and they have some really great grants. And I know some of you probably are participating in a grant that's called RCORP, which stands for Rural Communities Opioid Response Project or Program. So they're wonderful opportunities for funding. They are specific to rural communities. Now, I know they talk about how it's an opioid response, but I think you can focus on more than just opioids. But the main point is when you're writing the proposal, you do want to include information specific to opioid use, recovery from opioid use, whether that's addressing it through MAT or addressing it through other, whatever programs address that. But again, what I also want to stress about this is the fact that Georgia Council's HRSA grants were actually, we were sub-grantees through a university. Now, that might not be everyone's experience, but in our experience, we have been able to partner with Augusta University on some of these R-Corp grants. It's been a really wonderful relationship with Augusta University, and it's grown. So I want you to just think about that. Again, I'm going to stress a million times over the importance of partnerships, because I just can't see how we could do the work alone, because we need credibility from other organizations. We need input from other organizations. We need these mutually beneficial relationships, right, in the work that we do, because it's all about community, right? And so I will suggest that if you can partner with a university on doing some of this work, it's wonderful. We partner with Augusta University, we partner with Mercer University, and we also partner with Emory University on these HRSA grants. And it's been fantastic, because the other beautiful thing about that is you get people who really, they might start off not knowing anything about recovery. They just know they want to help people and they don't know how, right? And like, for instance, I have two examples. Working with a PhD at Augusta University, didn't have really any experience at all with addiction, recovery, none of it. And he's come so far and just is such an advocate now and such an ally for recovery. It's a really beautiful thing to watch somebody who's not in recovery, but it becoming a really beautiful ally for recovery. That's come out of that relationship. And then I will also say another experience that we've had is working with Emory University. This is the first time this doctor, she's a physician, has ever written a grant. She didn't know anything about writing a grant, right? So she got some support from another physician, and she just wanted to help people because she was tired of seeing people come to the emergency department. And she's getting a firsthand look at what stigma is doing in communities, right? The stigma of people coming to the emergency department over and over again, and she wants to do something about it. So we're able to work with her, with Emory University, and through these HRSA grants. They're just wonderful experiences. So I strongly suggest looking into this, finding some partners, see what you can find, because there's some amazing work being done, and you guys are doing amazing work. And if we can bring that all together, the possibilities are literally endless. So I just wanted to share the HRSA resource with you. So again, we want to talk about these, knowing the language, right? So you're going to see a lot of language in these grant proposals. I'm sorry, in these funding opportunities. Again, that's a notice of funding opportunity that are acronyms I had never heard before. Now, request for proposal I had heard before, but some of them, like, I didn't know what they were. So I sent out a list of some of the most popular acronyms to consider. And if you don't know something, just Google it. You'll find information about what it is. And a lot of times they'll break it down for you in the grant proposal. And we're all familiar with acronyms. We use acronyms every day, right? So that's just another thing to consider when you're reading the opportunity. And another thing that I spoke with Jean about, just to bring up, the grant will, the actual opportunity, they will be very specific about what they want. They will ask you clear questions And what you need to do is make sure that you answer those questions to the best of your ability. They will also give you very clear instructions on how they want the proposal to be submitted. So they will tell you 12-point font. They will tell you what spacing to use. They will tell you what margins to use. They will be very specific, but that's the thing. You got to take that 80-page document and you really have to read it. You have to read it. And you can break it out into chunks if you need to. That's another recommendation I would say. Break it out into sections so that it's easier to digest. But there's very clear instructions in these grant proposals. Somebody spends a lot of time putting that information together. So you'll want to take your time and read it. But again, just knowing the language can be very, very helpful. So hopefully that attachment that I sent along is useful. So let's talk a little bit about the process. What do we need to do to apply for a grant? Once we figure out where we're going to apply or who we're going to apply with, let's dig into the process. So I want to go back. I think we need another.
Was there a poll question, Emily?
Yes.
Yeah, let me get it pulled up. It is number 3, I think.
I wish I could get rid of those annotations.
There you go.
all right.
Is this it? If the grant proposal is due in 60 days, we should start working on it
Yes.
the week it is due, 2 weeks before, or immediately. I think this one is a bit of a giveaway.
I know, I do. I definitely can make these hard enough.
37 people, 39 people, and no one has missed it yet.
Awesome. Very good.
There we go. I will share the results. Everybody knows to start working on it right away.
Awesome.
All right.
Well, well done. So yeah, and this is another thing that I've learned from doing this work. I learned this working with Larissa a lot. We've written several grants together. George has been very helpful. I'll pull resources and help from everywhere to create a grant proposal, but you want to create a checklist. Get yourself a checklist. A checklist is so helpful because there are dates that you really need to consider. You need to be mindful of when things are due. The first step is getting yourself registered with SAM, because that may take a little bit. It may take a little bit of time. You might have to get something notarized. You might need to, there are things that you just want to consider so that you don't run out of time. That's really the point here, is that you don't want to run out of time. Give yourself the opportunity to set yourself up for success. Okay, so if you need to get letters of commitment, if you need letters of commitment from DFACS, if you need a letter of commitment from the fire department, if you need a letter of commitment from Department of Community Supervision, if you need a letter of commitment from another RCO, get that stuff. Get your letters together. Make sure that you have that information sent out. Like, for instance, let me give you another example. We are applying for a CAPTA grant, and CAPTA, you have to forgive me that I don't have the acronym correct for CAPTA, but it's a grant with DFACS. And if anyone else is applying for it, God be with you. I hope you get it. It's a 1-year grant. It's like max of $200,000, and it's very involved. You need a lot of documentation. Okay, that's where things get tricky, because you got to make sure that you get out and get this information in a timely manner so that you gather up all your documents and get them submitted in a timely manner. I cannot stress this enough, honestly. The first B Corps grant, Building Communities of Recovery grant, that we tried to apply for back before I started at the council, like in 2016, they missed the deadline. We missed the deadline. We just didn't get it in time. So be mindful of this, because that's a big deal. This CAPTA grant, it requires what's called a corporate resolution letter, right? Have I ever heard of what a corporate resolution letter is? I was like, what is this? I have no idea what this document is, but we had to have it. So I had to figure it out. So I looked at the document. What it turns out to be is we need to get board approval to participate in this project. Now, why they call it a corporate resolution letter, I don't know, but that's what they call it. So I had to take a look at it. It was a template of a letter that we needed to send out and ask our board to have like a, an emergency meeting. So it's not an emergency, but it is something we needed to have consensus on, that they agreed that we would participate in this project. So you got to have the executive director to look at it, got to send it out to the board, got to have the board review it, got to have the board sign and approve and sign it. Then you got to send it back and have it ready to go to put into the proposal. So you see what I mean? There's a lot of steps involved in that. So it's something you got to plan for. That's why the checklist is so important. You need to get together with the people that are going to be involved in the project so that they know what they're doing and that you know what you're going to be putting in your proposal. You got to spend some time researching your statistics, going out and getting your resource, your information from the Department of Labor, the Bureau of Labor Statistics, go out to the Georgia Department of Public Health and get some information. All of this stuff takes time, and we're all busy. So just start to think about that. If you get yourself a little checklist of what needs to be done when, it's very helpful. So I just want you to just consider how much time you have, get started right away.
So Emily, I'll give you a time countdown. We're halfway through.
Perfect. We're doing great. Awesome. Thank you. So your statement of need. Okay, so this is where you start to really put your proposal together, starting with what they generally call a statement of need. Why is this so important? Well, we know why it's so important, because people are dying, right? We know that people are dying. What do we want to do? We want to stop people from dying. We want to encourage more people to find recovery, and we want to help them do that. So let's talk a little bit about the need. Again, go out to Bureau of Labor Statistics, go out to Department of Labor, the Census Bureau, go to the Department of Public Health, go to SAMHSA. SAMHSA is a great resource for information. So what you want to do is you want to gather the reasons why this is so important. You want to start to think about the target population of who you're going to be serving. Are they, I'm sorry, did somebody say something? What age group are you going to be serving? What counties are you going to be serving? Where is, what are the overdose statistics in that region? All of those things play into this. So you want to be very specific about what's really happening. Give them a really good, clear picture of what you're faced with, right? So that they understand the importance of funding this project, because they'll see that this really needs to be addressed, right? So you want to explain to them, to the funders, why this is so important, and statistically back up everything that you're saying. And what you want to do with that information is you want to cite it. Don't forget to cite your sources. If you need some help with that, I did send some information about that as well. You can go out to, there's all sorts of helpful tools out in the, my battery's not dying, out in the internet that can help you with citing sources and how to collect that information, etc. But that's really kind of, it's a very important piece of this. So you want to establish a statement of need about why this is so important. The next thing you want to do is talk about your organization's qualifications to do the work. Why should they choose your organization? And so what Georgia Council does for this is we talk about, when we were founded. We talk about the founding of the CARES Academy, when that got started, how that got started, how many CARES, we've trained to date, and some of the other things that we've been able to accomplish since we've been doing this work, and just kind of, really just talk about the great work that you're doing in the community, and just really kind of brag on your organization, because we want to talk about why you're qualified to do this work. What value do you bring to this to the project. So as opposed to picking, you know, this organization over here, why would they want to choose you? And that's really important as well. So let's talk a little bit about, again, we already talked about describing your organization's qualifications. So then what we want to do is we want to get into describing the project in detail. And you want to create a timeline or a chart of who will do what when. And I put an example of that in here as well. So who are the key players? Let's think about that. And this is really, really important. I had a conversation with Jean about this also. The key personnel. Really start to think about how much is it really going to cost to make sure that we can do this work and do it right? But to gather that information, you want to start to think about who you're, and they call them key personnel. SAMHSA calls them this. So you're going to have a project director and a project coordinator. Those are basic, your two basic key personnel. And that could be, you know, whatever you call that, but just start to, that's just an example of who your key personnel is. Who's going to do this work? Are you going to have a supervisor and a peer coach? Are you going to have, you know, whatever that looks like? Think about that. You want to have their biographical sketches or their, you know, their resumes ready to go. You want to determine how much of a level of effort are they able to apply to this. So if they're already working on a project, think about it in terms of percentage. How much of a percentage can they apply to this project? Are they able to apply 100% to this? Or do they kind of have to split up their time between this and another funding source? You know, like, you know, some projects I'm only on 10%, and then others I'm on, you know, 30%. Just depends, right? So start to think about that. And then you've got to get your partnerships and letters of commitment and support. We talked about that. Drug court, DFACs, etc. Whoever's going to partner with you, get their qualifications ready to go, so you can talk about who they are, right? So you talk about who you are, who your organization is, then you talk about who your partners are, and then you're going to talk about contractors. Of course, I put George on here because George is a wonderful person to contract with, because he's amazing and he's a super big help, and he's just a wealth of knowledge, and he's been so incredibly helpful in the projects that we've done. So I used him as a perfect example of someone you might want to contract with, which means you give him a subcontract for X amount of dollars to provide X amount of trainings, you know, sort of something like that. It could be another organization, or it could be a data evaluator. Again, so same with data collection. You could get a PhD, a grad student, someone that you really enjoy working with. It could even be a person in recovery who's getting their PhD. Ask them if they wouldn't mind helping you with data collection or data or program evaluation. That really adds a lot of credibility to your proposal. Having PhD, having someone from a university, and they'll look over your grant proposal too. I mean, it's really a great resource. A university is a really great resource of support. All right, so again, back to the statement of need. You want to research, I'm just recapping here. You want to research the issue. You want to find the appropriate statistics to support your case. You want to cite your sources. And then this is an example. So here we're going to start talking about setting up your goals. And so this is an example of a project goal. So to increase the number of peers who find meaningful employment upon returning to the community after being incarcerated, what we're going to do is we're going to develop an employment services program in ACE County. Okay, so that's a very clear, specific goal of what we're going to try to achieve with this grant. So I'd love to get a show of hands on how many people have heard of this before, because this is really, really important. Goals should be SMART, right? You want to be specific. Oh, yes. George, do you want to share?
That's George's show of hands that he has heard of SMART, I think.
Oh, great. Okay, great. Yeah, so great. Oh, wonderful. Thank you. So SMART is so important. You want to be very, very, and I've learned this the hard way. You want to be very specific, State what you're going to do, how you're going to do it. And you want it to be measurable. Why do we want it to be measurable? I'm sure that you guys will know the answer to this. We want to be able to show that our program works, right? At the end of this program, we want to be able to say that we helped this many peers find employment, right? That's what, and then the idea is once you show funders that you're able to do it, they'll fund it again. And then more funders will come along, right? So you want to be able to measure the project. You want to have it be achievable. Again, this is another thing. You don't want to go too low and you don't want to go too high. You want to make it achievable. Make sure that you're able to do what you say you're going to do, right? When you said you're going to do it. And be realistic about it. You really got to be realistic and relevant. Relevant is another one, and this could also be realistic. You want to make it make sense. And this goes along with everything we do. Again, stay within your mission, stay true to your mission, and make it really make sense. The work that we're doing, are we over here trying to build clock radios? No, that's not going to be relevant to what we do, right? That doesn't have anything to do with recovery. Do we want to start a program where we can help people coming out of jail and prison to get employment? Yes, that's relevant. That's relevant to what we do, right? And then you want to make it timely. So again, you want to build something that you can meet the deliverables with the time that you're allotted to get that done. So again, examples. These are examples of project objectives that are very clear and concise, because what happens is your objectives help you meet your goals. All right. So your objectives are the building blocks that are going to help you achieve your goal, right? If your goal is to help peers, these are how you're going to help the peers. This is how you're going to do it. Okay. So just an example, you're going to assist a minimum of 20 peers with resume writing, interview assistance, and job placement. You're very specific, it's measurable, it's attainable, it's relevant, and it's timely. Okay. Track the progress for the minimum of 20 peers from initial contact with the RCO and throughout the project period. There's your timeliness. And within 12 months. And then you're going to collect all your data, right? You're going to collect it at the first encounter, you're going to collect it at 6 months, and you're going to collect it at 12 months. That's a pretty good system, right? You're doing the work, you're tracking the work, you're reporting the work, all of the things. So just be very, very specific. So what I'd like for you to see here, and I know it's kind of small, and I apologize, I tried to make it as big as possible. This is an actual grant proposal. This is our B Corps grant that we currently have. So if you can see here what I learned, and I learned this from someone from Augusta University. I didn't create it. I will not take credit, but I think it's great. It's literally a chart. This chart will help the funder see what you're going to do, but it also helps me. It helps me go back, because you might not get funded for a year. Like you might submit something and 9 months down the road, you get the award. I can't remember what I wrote in that thing. Like, I don't remember what I said. What did I say we'd do? Well, you can go back and look at this chart, and it tells you exactly who's going to do it, what they're going to do, when they're going to do it, and all of the things. So just think about that, about being very, very clear for yourself and for the folks that you're submitting the proposal to. So if you have a hard time seeing that, just let me know, and I'll try to send you some information. But again, you see how very clear it is. This is what we say we're going to do, right? And we're going to meet these deliverables. So now we're getting into the budget. So the budget narrative. All right. So creating a budget is really tricky, but it can be done. Basically, the idea here is you want to break down who's going to do the work and what you need to get the work done. So you're going to have personnel costs. You might have some travel costs. You're going to have some equipment costs. You might have some supplies, right? You're going to need to get some stuff printed. You're going to need to get some, you might need to order, you might need to buy a printer, you might need paper, you might need postage, who knows? I don't know what you need, but you might need some things. And then you have down here contractual, so contractual. And that would be where you list the contractors that you're gonna pay out of the grant. So again, so you want to consider who's going to do the work, how much of a level of effort, what their salary is, how much of a level of effort they're going to put in. And then you want to calculate that out. You also want to consider fringe. If you're paying benefits, if you're paying payroll tax, if you're, then you want to, we use 28%. So whatever the base salary is times 28%, that 28% is fringe, covers paid time off, etc. If you need more information about that, I'll be happy to help provide that. But that's something you want to consider. How much is the
So,
base salary? Yep.
Emily, Ada asked if you can do a larger view. I don't know if you can zoom in.
I know. I really don't know if
PowerPoint.
I can. I mean, I sent Ada. It's on your. I did send you the PDF.
And we will send things out again with your certificate. And if I need to send a larger version of it, I can.
I don't know why my computer's not charging. It should be charging now. There it goes. Oh, my I didn't have my computer plugged in. I'm sorry, you guys. Yeah, so yeah, and again, I'm sorry that it's not big enough, but you can find this on the Inspire. This is the Inspire. I kind of used Inspire because I thought maybe a lot of you might be interested in applying for it. So I used a lot of things from the Inspire grant. This is the budget narrative example that they give you in the Inspire grant proposal, the notice of funding announcement. So yeah, I'm sorry that I can't make it I could try to make it a little bit bigger. How's that?
Oh, look at that. It is getting a little bigger.
Okay.
But you can't see the whole page.
Right.
So,
yeah. So, all right. But we're going to go ahead and move on in the interest of time.
Emily, is there another poll or that we went by, or there's a 4, isn't there? Is it later?
Yeah. Not yet.
Okay.
Not yet. But we'll do it after we do this, and then thank you, Al. So again, this is again, I kind of tried to blow it up. Ada, hopefully you can see this. This is kind of I blew up the sections so that you can see who's going to be doing the work. You've got the project director, the assistant executive director, the executive director, HR manager. All of these folks are going to be part of this project at different levels of effort. You see, somebody's going to have 10%, somebody's going to have 15%, and the project director is going to have 100% level of effort. All right. And then again, indirect costs. Now, I don't know how many of you are familiar, but obviously you guys are a pretty smart bunch because you answered all the questions correctly. But indirect costs, I didn't know what this really was when I first started writing grants. What it is it basically covers everything that's not going direct to the project. So like if you have somebody who processes your payroll, or if you pay for QuickBooks to process your, your invoices and your payroll and stuff like that, the indirect would cover that cost, right? If you have an accounting person, the indirect is going to cover that cost. It's also going to cover probably your basic utilities, unless you're actually asking them for rent and utilities, a breakdown of rent and utilities specific for this project. Indirect's going to cover those costs. It's going to be anything. It's basically overhead, overhead. It's not directly on the project, but it's something you got to pay. So, and the reason why I bring this up is people have questions. Well, why can't we charge 15% indirect? The reason why you got to be careful with indirect is because they will question it. The funders will question it. If you stick with 10% indirect, it's called de minimis. It's the minimum. It's the minimum that you can ask for without anybody questioning it, or without you having to have additional documentation to support it. So as a rule, I would stick with 10% indirect unless you have what's called a cost negotiation with the federal government to make that indirect cost amount percentage higher. Okay, so just to be, now the thing is, whenever you're calculating everything out, you want to consider this, because you don't want to say, Oh my gosh, we got it maxed out at $200,000. Oh, you want to say, well, wait a minute, let's back that up because we want to take off 10% so we can cover our indirect costs. So you want to have all your direct costs add up to 200,000 minus 10%. And I know that might sound kind of confusing. If you need more information about how that works, I'm happy to help walk you through it and I can show it to you. But I just wanted to introduce that concept. Most of you might already know what I'm talking about. So again, here's just another example of travel budget. Travel now is up to the federal going rate for travel for mileage is 0.67 per mile. Please note that as of January 1, 2024, you can get 0.67 per mile. Okay, you want to keep that in mind when you're doing a grant proposal. And so this is just a breakdown of where we would go, how much it's going to cost. There's a per diem you can go out and look up. There's a federal guide for per diem as well. I think it breaks it down by state and then actually by region, because like travel in Savannah is more expensive than travel to like Jessup in terms of food. Like food and I think lodging too. Some of those numbers change depending on where you're traveling to. So be mindful of that. Because like you might be able to, I don't know why they change it, but they do. So there are different amounts for different areas. So look into that. You can take just Google per diem rates or meal rates. And Jill and I can get you that information too. So if you need more information about that, just let me know. But again, this is the breakdown of travel because you do want to travel. Like if you guys want to go to the ARCO conference, the Alliance of Recovery Community Organizations, I think they changed the name of that. But if you want to go to that conference, put it in your proposal. Or the RX Summit, that's coming up. If you want to go to the RX Summit, put that in your proposal. So here is just kind of a budget narrative example. This is where if you put in your budget, this is the project director, this is what they're going to be doing, this is how much their salary is, this is what this is their level of effort. Then underneath that, you have to justify it. So it's called a budget justification. So you write up a little paragraph about who's going to do that work, right? What they're going to do and why they're qualified to do the work. And you do this for each person, and even including your contractors, you do this for each person. It doesn't have to be really long. It just has to be very specific. Who are they? What are their qualifications? What will they be doing on the project? Just answer those questions, okay? I don't know if everyone can see that. I'll give you a minute. I don't want to run out of time. But yeah, so this is who's doing the work. That's my dog. He's doing the work and he's going to work with peers. And this is how much we're going to pay him. And this is for how long we're going to pay him. Okay. All right. And now, once you get all of that information together, at the very end, once you get everything all lined up and you figure it all out, then you got to summarize it. So basically, this is the summary, but you do it last because you got to have the project all out on, in a document. And then you go back and you say, okay, now within 500 words or something like that, they'll tell you exactly how long it needs to be. They'll tell you we need to have an executive summary because that's the first thing they look at. So a funder will look at this, they'll read this one pager, right? And they'll be like, oh, I want to know more. And they'll set that document over to the side so they can continue reviewing it. If they look at it and they say, no, I don't want to do this, or then they'll put it over to the side and it's not going to get funded. Okay. So you want to make sure that everything in your executive summary really hits the high points of why you're going to do a great job in this project. All right. If you need an example of what an executive summary looks like, happy to share that with you. But basically, it's just a concise summary of the project. Sometimes they call it a project abstract. Sometimes they call it an executive summary. It's the last page written. but it's the first one they see and they read. So these are portal examples. This is one that we did with Lucy McBath's office, like I was sharing. Very, very simple job form, right? It's just a job form. Name, email, phone. What are you going to do? How much money do you need? Boom. Very, very simple. I mean, some of them are that simple. Another one, CareSource Foundation. Check them out. CareSource Foundation. CareSource was at ARAD today, folks. They are awesome. They are a great source. I highly recommend you check them out. They're lovely. So you go into their portal. This is their portal. This is what I did. I went in, I signed up, I logged in, and they give you just basically like I showed you with the Lucy McBath one. They ask you this, and you just fill in the box and apply for funding. It's that easy. Now, again, they're gonna ask you for documentation. They're gonna ask you for, the letter from the IRS, possibly. They might ask you for there's things that they're going to ask you for, but you'll come along and you should have all that documentation. Here's the Inspire grant. Okay, this is what the page looks like when you go to it. All you have to do is Google Appalachian Regional Commission Inspire, and this will come up. Again, it'll show you the map of what counties are affected. And you can go in and look at what other organizations have been funded in the past and what the work, what work's already being done. Highland Rivers up there in Northwest Georgia, they have an Inspire grant. They're going on, I think, year 3 now. They'll be going into year 3 of their Inspire grant. If you want to reach out to them and ask them questions, you might want to do that. But again, so this is what it is. And then all the instructions are there on how to apply. They have a webinar that you can review. And yeah, so I just wanted to throw that out there. This is definitely an opportunity. And then the payoff, we're about at the end now, folks. So I do want to leave enough time for questions, and we're at 6:10. So, but the payoff really is the reward. Right? I've been so grateful for the opportunity to be able to apply for grants. Applied for a lot, don't always get them, but it's really a great, anytime you work on one, it's practice. So just practice, apply, see what happens. You can apply it, a community foundation or, just give it a shot and see how the process is, and then you'll get better at it. And what did I miss? And what's really beautiful is if you do apply for something like the Inspire grant, or there's some other ones I would check out also, challenge.gov. They have some neat opportunities for funding. And what they'll do is when they review your grant proposal, if you don't get funded, they will send you back feedback. So you can look to see what happened, what we need to do differently, what we didn't have in there, and you can, reapply. So they're really great about that. SAMHSA's really good about it. The Inspire grant, they will send you feedback. They're really responsive. You can write to these folks. Don't be afraid to reach out and ask them questions, because they'll be happy to help you. Even Captain DFAX is great about responding to any kind of questions you might have. They're very, very helpful. So the reward here is recovery, right? We get to do the work. We get to be in communities and help people. And it's a beautiful thing. And then, of course, I had to put this on there because this is grant funded, ARAD partially. We've gotten some support from DBHDD. Mostly it was really just sponsorships paid for it, but we couldn't have ARAD if it wasn't for funders, and all of us coming together, and we're all grant funded, or privately funded. So I just wanted to put this in there because it was such a beautiful thing, and I'm so grateful for the opportunity. Yeah, so I'm going to wrap that up and see if you guys have any questions. So I see, Cindy, you have your hand raised. Do you have a question.
Yes, I do. We've been looking, I've been looking at the ARC grant this week. And I noticed, I did go back and look at some of the awardees from last year.
Okay.
And I did notice that the majority of them had a smaller amount funded the first, like for a year of development and planning.
Yep.
That's the first time, you know, at Never Alone, we've applied for quite a few grants, got a couple, but that's the first time I had noticed that. And so have you noticed that with some other grants, or is that kind of an AR? Well, because that returning to workforce is quite an undertaking where they're wanting you to do a lot of needs-based assessments type things. So I wasn't familiar with that until just this week.
That's a great question, Cindy. Yes. And Mercer has a grant like that as well. So that's a very, very good question. What they will do is for that first year, like the one we're doing with Mercer, they're giving us $2,000. $2,000, right? I mean, for a whole year. we're going to plan. That's all we're doing. We're just going to plan. We're going to meet, we're going to plan, we're going to figure it out. We're going to meet, we're going to plan, we're going to figure it out. We're going to do that for a whole year. And then we apply for the implementation grant. So as we have this great plan together, then we'll apply for the implementation grant. So that's a fantastic question. We've done that with Mercer University. They do that with the Inspire grant. You don't have to apply for that. You can go ahead and jump right in and apply for the implementation grant if you want. If you have, like I said, if you have a proposal on a shelf and you're ready to hit the ground running, you can bypass that planning phase and go right into it. Or you can ease your way in and accept a smaller amount of money and just work on planning, there's nothing wrong with that. You can go either way. We have another one with a Criminal Justice Coordinating Council. That's a planning grant. We're just going to meet. We're only getting, oh gosh, it's a small amount of money, but we'll take it. You know, we're going to plan. We're going to get together. We're going to do some of these assessments. And as opposed to a needs assessment, I learned from George, we do asset-based community development. So we look at the assets as opposed to the needs. Just saying, as opposed to the deficits, let's look at our assets. Start with strength-based, you know, assessments. But that's a fantastic question, Cindy. Did I answer your question? Cindy? Hello?
Yes, that was great. Thank you.
You're welcome. You're very welcome. Shelley, you have a question?
I do. And I don't even really know how to ask the question, but I'll do my best. So if you are working for an organization where you're funded by a different entity, let's say the DBHDD, and then you apply for another grant, and when you were going over talking about the salary breakdown of the salary is going to be paid for this, and then maybe 10% to this person, 10% to this person. Well, if those salaries are already being paid by the DBHDD, is that something that you wouldn't ask for, even if you like hired another person because it's another program and paid them 100%? Where does that 10 and 15, where does that go?
Excellent question. What that's called is a match. So, and that actually works to your advantage, because what you can say is, well, this person may work 10% on this project, but their funding will come from a different source. They're going to be so in other words, what I like to do is I like to look at it like tracks like this. So where you're getting this funding from this source over here, right? But you really want to have another program. How do you do it? Well, what you do is these two people might be paid out of DBHDD, right? They're going to do this work, but then these two people are going to get paid on this other grant. Say, let's just say a SAMHSA grant, just for example's sake. So we get federal funding for these two people. They're all going to work together, right? But they're not all going to get paid on the same, out of the same funding source. And I can work with you more on what that exactly looks like, because I know it sounds a little confusing. It was very confusing to me at first. As an example, I worked on the B Corps grant, so my pay was coming out of the B Corps federal funds. Brian was working on RCO development. His money was coming from DBHDD. I'm getting paid from SAMHSA B Corps. Brian's getting paid from DBHDD, but we did the work together in communities, right? So we're doing the work. We're both, he's helping me with B Corps. I'm helping him with RCO development, but we're getting funded from two different sources. But they love that. They love the fact that they're not solely putting all their eggs in one basket, that you have other sources of funding to support the work. That is a plus. That is a definite benefit, having different funding sources to help support the work.
I guess the second part of that question is, so you wouldn't actually put money for the person helping into that grant? It's not something that could go back into the organization?
Well, think about it, Shelley. If you're getting paid 100% on one project, you can't get paid. You can't be 120% of a person, right?
Right, that's just where the confusion was for me. So
yeah.
I just wanted to verify that.
Yeah. You gotta, and
Just
you
helping.
can, if you might need to modify some stuff or change some things around, but yes, you can't, you can only be, I've run into that. I know exactly what you mean. Yeah.
Okay.
Good, great question. Great question.
So Emily, in the chat, there's a lot of thank yous and congratulations. Anthony Gray, Cindy Dowdy, Jasmine Turner, Yuri Kyriakos, Shannon Rapier. Yay, everybody's grateful.
Well, good. I'm glad.
You answered Shelley's question about, do you have to specifically itemize, or can you just put indirect costs? Do you specifically itemize your indirect costs?
No, you do not need to specifically itemize indirect costs, but be careful with that, but you can, no, you don't really need to do that, as long as you keep it at 10%, or less, or less. No, that's a very good question. No, you do not. But other things you do need to be pretty specific about, and they're really funny about, like, I know this doesn't happen very often, but you can't really ask for construction money. I don't know why we ever would, but I guess you could, because I know, like, some folks need to have something built out in their RCO or whatever. That's very difficult to get funded. I'll tell you that, as far as like SAMHSA goes, or that construction is not something that gets funded. And then you also need to kind of consider the difference between equipment and supplies. A computer is not supplies. A computer is equipment, because it's a piece of equipment that depreciates over time. And that's something to consider. So just read what it says in the project, read what it says as far as what equipment is and what supplies are. Supplies are generally like pens, paper, printing, postage, stuff like that. And equipment would be a computer or a printer, actual, equipment that you need to do the work.
So Emily Lauren Saporito wants to know, did you have past experience in this focus?
Before I worked for the Georgia Council, kind of. I worked in contracts. I was a government buyer, so I'm familiar with like, technical writing, I guess. I don't know how to explain it, but I'm familiar with contracts, but not specifically writing grant proposals. Yeah, great question. Thank you for asking.
Other questions? You will get a PowerPoint with your certificate.
I already sent 8 of the PowerPoint. I'm just saying, so you guys are welcome to it. And if you have any questions, again, my email is here. If there's anything I can do to support you, I know there's a lot of information. And like I said, I did not learn how to do this in one day. I had a lot of help. It's all about asking questions and If there's anything I didn't cover, I apologize, but I just try to help you with what.
Yeah, I think you did, Emily. You know, like I say, reading the comments and just watching the reaction, like you answered a lot of questions and surely got I'm sure our peers thinking and you know if they already in the process or what's next or how to get started. So thank you for your information and your expertise in this field.
Yeah, you're very welcome. It's my pleasure. It's my honor. It's an honor to be able to do it. Thank you.
We could take another question or two. We got 5 minutes. Anybody else has anything? Emily, I will say that Anthony Gray said something about teaching SMART, S-M-A-R-T goals to his students.
Oh, wonderful. Wonderful. And yeah, so just another point just to bring up is some of the things that they're going to ask you for. You might get like some documentation about where to send payments to, and they call those vendor supplier information, a lot of things like that, like you know, your IRS letter they're probably going to ask you for. And then they might start asking you some questions about, have you ever been audited? Have you ever been debarred? Like certain questions about that. That's a little bit more complicated. So you want to think about some of those things. There's some things that they're going to ask you for that you may have questions about. But that's okay because you're not you know, they ask everyone these questions. And if you have any questions about what they're asking for, you can reach out to the grants officer. Like I said, they're really, really helpful about answering those types of questions because everybody has to start somewhere, you know. But again, I encourage you guys to apply for a federal SAMHSA grant and just to see what it's like, just to get that experience of you know, of how the process works, because it's definitely a process. But yeah, thank you so much for your time. Thank you for coming tonight. This is exciting. I'm really appreciate it. And I wish you the very best. I hope you all get grants. Everybody.
You are super awesome, Emily. Thank you so much.
Thank you.
All right. If there is no other questions, I guess we could give you 3 more minutes of your evening back if you'd like to. So you will get a certificate in the next week or two. And keep an eye, it'll come from Alvin Cotton. Keep an eye out in your folders. You know, sometimes if it's a Gmail, it might go to your promotions folder or into your junk or your the promotions is what it is in Gmail. So just keep an eye out for it. It'll come before the end of next week and you can search Alvin in your inbox to find it. Tara, I'm going to throw it back to you.
All right, thank you all for coming. Like Al said, we had like 3 more minutes, but I think Emily did such a great job of explaining everything and breaking everything down that she left all of us wondering what's next. So I think that with that being said, Al already talked about getting the certificates. We talked about the PowerPoint. And we talked about the CEU. So thank you. You all have a good night. It's been a long day. Thank you.
Thank you, everybody.
Yes.
Thank you, Emily. That was really awesome.
Thank you.
Yes, it was.
Good night.
Yeah.
All right, let me stop the recording.
Okay.